Hi, my name's Megan Christner, registered dietitian with the Delaware WIC program and the University of Delaware. Once your infant reaches 6 months old, you can generally begin to introduce solid foods into her diet. Your baby has gained control over the muscles in her tongue and her mouth that are necessary for swallowing. Today, I'll provide you with some helpful tips for introducing solid foods into your infant's diet. I'll also show you an easy way to make your own homemade baby food using 5 simple steps. There's a lot to cover, so let's get started. To prevent choking, make sure your infant is sitting up. Start with a half a spoonful or less and encourage your infant through the process. She will not know what to do at first and may look confused, play with the food in her mouth, or reject it altogether. This is a normal reaction as she learns to eat solid foods and accept new flavors. Always use a spoon to feed your baby solid foods. Do not put foods in a bottle unless directed by your pediatrician. This may cause choking and increase the amount of food your infant eats, leading to weight gain. One way to make eating solid foods for the first time easier is to give your infant a little breast milk or formula first, then switch to small spoonfuls of food and finish with breast milk or formula. This will prevent your infant from getting frustrated when she is very hungry. Do not force feed your infant. If she cries or turns away when you give her the food, try again later. Be patient, it may take 8 to 12 tries before your infant accepts a new food. Many pediatricians recommend starting with an infant cereal, like rice, oatmeal, or barley. Try the dry cereals because they are richer in iron and allow you to control the consistency. Once your infant learns to eat one food, you can gradually start to introduce other foods, like pureed vegetables, fruits, and meats. Give your infant one new food at a time and wait at least 2 to 3 days before introducing a new food. This allows you to watch for allergic reactions, such as diarrhea, rashes, or vomiting. If any of these reactions occur, stop using the food and seek medical attention. While the WIC program does provide your infant with jarred baby foods, making your own is simpler than you think. I'll show you how to do it with these simple steps. This recipe uses 2 pears. Make sure to wash, peel, and cut the food into small pieces. Next, steam on the stove for 10 to 12 minutes or in the microwave for 8 to 10 minutes until tender. In a food processor or blender, puree with 1/4 cup of breast milk, formula, or water until smooth. Add more liquid as needed. Spoon the puree into ice cube trays. 1 cube usually holds about 1 tablespoon of food. Cover and freeze overnight. Store frozen baby food for up to 3 months in the freezer. The next day, pop out the cubes and place in a freezer bag. Store in the freezer until you are ready to use them. Defrost cubes in the refrigerator overnight or in the microwave for immediate use. When solid foods are new to your infant, only defrost 1 cube at a time until she starts to eat more. It is important for your infant to get used to the eating process. Remember to offer a variety of foods to ensure that she is getting the nutrition she needs to grow up healthy. Learning good habits early can help ensure a lifetime of good eating habits.